Okay, we're going to call the meeting to order. Chelsea, are you ready? Okay. So, good afternoon, everyone. My name is Dick Clinton. I'm the Vice President of the Winnebago County Mental Health Board and chairing today, pardon me, in place of our President, Mary Ann Abadi. So we would like to first call roll of our board. Mary Ann Abadi, Dr. Copeland, Dr. Giardini here, Dr. Gorski here, Richard Punter here, Wendy Larson Bennett here, Tim Neighbors, Linda Strangquist, and then our Executive Director, Jason Holcomb, and Chelsea Blance, and Nicole Bennett, here, and our guests this afternoon. So we would then, we have no public comment that I'm aware of. No. Okay. And then, so we're going to talk about presentations, and today we have with us staff members from Youth Services Network. So would are you going to be the spokesman?
Yes, I am.
Spokesperson? Yes. And then your name, please.
I am Becky Gilo. I'm the program director for the Youth Trauma Clinic.
Okay, thank you, Becky.
Sure.
Becky, you want to move that out for if you want to sit behind it? I know you feel very comfortable.
Sure. Cheers from me then. Yeah.
There you go.
So, yeah, so I'm Becky Gilo. I brought with me some of my staff. Not everybody could make it today, but I have 3 of our therapists. I have Brittany Nancy, Ebony Waller, and Leandra Hinson. And then I also have one of our case managers, Stephanie Lynch. So that's my crew over there.
Welcome, people.
So just a little bit of general information about Youth Trauma or Youth Services Network, excuse me. We are a nonprofit agency here in Rockford that covers a lot of Northern Illinois and various services that we have. We have counseling programs that deal with kids in foster care, primarily children and families dealing with foster care issues. We have our Birth to 3 program doing early intervention services. We have programs that do juvenile justice programs. We have 3 school-based programs here with Rockford Public Schools. We have 2 youth homeless shelters, and then we have the Youth Trauma Clinic. So, I don't know. Maybe the next one. Yeah. So to qualify to work with our staff in the Youth Trauma Clinic, we have kind of 3 basic requirements. They have to live in Winnebago County. They have to be between birth and 21 years old and have experienced a trauma that is impacting their mental health in some way. When looking at trauma, we are defining a trauma experience as something that is kind of outside of the normal experience that overwhelms the youth's ability to cope, understand what they're feeling, understand what's going on, involves intense fear, helplessness, hopelessness, and they're just not able to really identify what's going on and tolerate their feelings. Some of the common trauma experiences that we are dealing with have been exposure to domestic violence in the homes, community violence, physical, emotional abuse, parental divorce, death of a loved one, bullying. We've gotten a lot of bullying cases, and even just living through the pandemic has been traumatic for a lot of youth in Winnebago County. Our goals that we are trying to maintain and meet for the Youth Trauma Clinic. The first one is that we have reduced waiting times for mental health services for these youth. The second one is that we are reducing trauma symptoms and reducing mental health symptoms. And the third one is really improving the youth's functioning in their home, their school, their community, whatever setting they're in. So with the youth trauma clinic, we offer therapy services. We have 4 therapists, 3 full-time, 1 part-time. Our staff are providing the youth with a trauma assessment where we assess what trauma experiences they've had, what their trauma symptoms are. We create a mental health assessment and treatment planning. But diagnostically, we are giving them most likely post-traumatic stress disorder, maybe another lesser trauma-related disorder, depression or anxiety. We use evidence-based trauma-informed models for therapy. These are pictures of our therapy spaces that we've been able to provide using the funding from this board. But we use EMDR, play therapy, sand tray therapy, art therapy, TFCBT, trauma-focused cognitive behavioral therapy, sand tray, play therapy, I think I said them all. Whatever's gonna meet the needs of the youth best. For case management services, we have 2 full-time case managers. And we're providing wraparound services to the youth and families. Our belief is that in order to really stabilize the youth, we also have to stabilize their family and their family needs and really help the whole family approach. So our case managers are providing child and family team meetings, really about quarterly, once a month, to assess needs, to assess how they're doing in the program. We are also attending school meetings, whether it's IEP meetings, disciplinary hearings, helping the youth with homework or just behaviors in the classrooms that they're having. The case managers are also helping find community resources, housing, utility assistance, food assistance, any other transportation needs that the family might have. They're also doing mentoring and providing life skills trainings for the youth in our program. Myself, as a program director, I am providing the clinical supervision for all of the staff, working on just clinical supervision stuff, but also hoping to reduce the vicarious trauma that our staff might be feeling. I currently have done over the past 1.5 years about 13 trauma-focused trainings in the community, whether that is through YSN, through the Regional Office of Education, just various people. I'm also part of the Winnebago County Violence Reduction Committee and part of that training committee work group. So providing trauma trainings that way as well. So our clinic services are all community-based. So we tend to meet the clients where they're most comfortable. It can be at our office, it can be in the client's school, it can be at home, it can be in the community, taken to a park, wherever they are feeling most comfortable and therapeutic. We do provide on-call 24/7 services and a walk-in portion of our clinic, so people can walk in and receive services. All the services are free to the youth and families. We have met kind of our goal of reducing the wait times of services for mental health services because our families are receiving follow-up services within 24 hours of the initial phone call. And we do a lot of collaboration with other community organizations or schools or daycares to meet the needs of the family and more specifically the youth. Over the last 1.5 years, we have received about 250 referrals, a little over actually. We get our majority of our referrals, these were kind of the top 5, Family Peace Center, juvenile probation, schools, daycares, other YSN programs, and Crusader Clinic. But sometimes they don't even have a referral. They just call us, they found us on Google and call and say, hey, my kid's been through some stuff. I'd like them to get services. So, but these were our top 5 referral sources that we're getting. Of the 250 youth that have been referred, 175 have received or are currently receiving services. And of that, 73% have reported a reduction in symptoms, in the trauma symptoms. Our therapists are doing the trauma assessment at the beginning and then at 6 months and at closing. So 73% have reduced their trauma symptoms. 21% have said no, whether that was because they haven't been open long enough or some came in with very little and they just are not reducing their symptoms. And then 6% really haven't been open long enough to get a comparison trauma assessment. So how has this funding really helped YSN and the trauma clinic? It has provided us with the ability to purchase items for therapy rooms, to really dedicate a play therapy room, a sanctuary room, an art therapy room. We have been able to increase our therapy supplies and our interventions that we were using with the youth. We have been able to support staff in attending evidence-based trauma-focused trainings, and really allowed us to support the youth in experiences and opportunities that they probably wouldn't have had if they weren't involved with our program. So it's kind of us in a nutshell.
Becky, can I, and I'll address all of you for that matter, you can answer the question. You average 250, is that what your average is per year?
That's what we've had since we started a year and a half.
So this is the first time.
Yes.
Did I stand corrected? You said that you get a lot of different traumas. What is the bulk of your traumas that you get? What do you see the most of? Is it bullying? Is it something community-wise? I'll present it. You have a good number, fine. If not, no big deal. Just curious.
What, sorry, I feel like it's kind of all equal with the MMR, with bullying, as well as the community violence, or trauma.
What is the average age that you think of the kids that you're getting?
And
Put a number on it.
we get 2-year-olds up to 20-year-olds, 11-year-olds. So, I mean,
There's no average then of that sort of thing?
not, I mean, probably more early, not maybe like 5th grade through 17, 18 would be our bulk,
Okay,
but we do get littles and
okay,
just
sure.
kind of spread throughout.
Yes, sir.
And
Let me ask about your crisis services.
Yeah.
You say you're available 24/7. How frequently do you get calls at nights and weekends to go out and deal with crises?
and we have been fortunate that we have not had to have too many. YSN also has a crisis program, so a lot of our crisis calls go through them, and then they would call us that somebody really needs to be in the trauma clinic. So I would say we've had very minimal for that, but we end up getting the referrals then from the crisis program that goes out and meets with them.
Well, tell me then what you can about the other crisis services within YSN. I guess I'm curious as to whether or not they're having any kind of cooperation with Rosecrans and the police in terms of the CCRT program that's going on within the city.
Well, our crisis, it's called CCBYF, is different than that kind of, they're not usually dealing with the mental health crisis. It's more of a
Really?
lockout situation.
Okay.
You know, parents, the child has run away, they're more in need of like homeless services or
Okay.
things like that.
All right.
So if there is a mental health need, then they would call us.
Okay. All right. Thank you.
We do have quite a few police officers that call for support. And so that's really great to hear.
Okay.
I was just gonna, Nicole and I had a chance, this was a site visit that we took, so Becky took us through, we got to meet a lot of the staff, and very, very impressed with what you're doing, so thank you for that. And I apologize because I think this came up and I simply don't remember, so I apologize. You identify a young person who needs additional treatment, let's say medication. I simply don't, what are your avenues there of getting the child appropriate subsequent care?
So we would refer to either Crusader through their mental health program or Rosecrans.
Okay,
Or if they have another doctor that would be willing to provide it, because we do not have somebody on staff that can provide medication, so.
have you had any barriers to that subsequent referral?
Not really. I know Rosecrans tends to have a little bit of a waiting list, but I think as long as we continue to provide the services, we're recognizing that you might need something a little further that we can give you. So we're still providing the services up until they're involved with
Right.
whatever agency they're at.
Is that, and just my last thought, is that a pretty common occurrence, would you say, for the youth you're serving, that they need that next level?
I wouldn't say it's super common.
Okay.
We have had some that we've had to refer to various other places, but mostly we haven't had run into it too much.
Thank you.
And I'm curious about your 0 to 3 program. Where are you getting your referrals for those children?
For the early intervention,
Right.
child and family connections program, they get them through physicians. That they need a developmental screen, they need speech therapy, occupational therapy, those kinds of services.
Okay. I'm wondering about connecting what's going on at Chassis, their dual program with that. Because we're providing services for pregnant and early parenting families. But it seemed like you would be like the natural connection. And I'm hoping we can do more connection amongst the agencies that we're already funding so that we have better communication and handoffs.
Right.
I can get you information. For what she's
Okay,
saying.
and I can provide the information for the CSC program.
I used to work in the doula program at Children's Home.
Got it.
And so we have a really close connection actually, and Brittany over there will refer moms and I'll let them over to Lynn Riley or whoever's in that program over there.
You know, those personal connections make all the difference, you know.
Right.
Yeah, you can spread that out.
And then we also connect our families, their parents, to Children's Home and Aid program for parents. They have a peer-to-peer
Right.
parenting program as well as a prenatal group and things like that. So we refer back that way as well.
Awesome. Yeah.
Any other questions? All right, well, thank you for having us.
Thank you.
Thank you very much.
Thank you.
Pardon?
Make a note of that.
Yes, yeah, I'm going to do that. I just wanted to make a point that, Dr. Copeland has joined us, for this meeting and is now president. So this means that we have a quorum for today's meeting, so thank you. In our next order of business, we have our monthly activity report, and Jason is going to give us that information.
Well, you can see our report gets pretty long when we have 2 months to report on instead of 1. So I will try to be concise, but we do have a lot to highlight, a lot of exciting things. First of all, we had 26 abstracts. Board members reviewed those. We went through the process, obviously making recommendations today, but I just want to say how grateful I am to have Nicole on our team. She managed the process this year and definitely wouldn't have been able to take on that big of a thing without her expertise and leadership. And then in addition to that, she's also been scheduling these site visits and getting board members and staff engaged in those. And so how many have we done total so far now?
Like over halfway done.
Over halfway done. So again, another great update, something we've been meaning to do for a while now, and kept getting kind of put on the back burner, and finally we're able to get those scheduled and get out and review our funded programs. We do have our first mental health pathways work group. Partnership with Workforce Connection. That meeting has been scheduled. We have participation of not only mental health providers, but also of colleges and universities in the region that are going to come in and really focus on how do we build a workforce for mental health in Winnebago County. So I'm really excited about that. We'll definitely keep board members updated on the things that we learned from that work group and where there are opportunities for quick wins and also kind of those long-term systems change things. And then if I could highlight, kind of at Chelsea's initiation with my support, we filed a proposal to the Mental Health America Conference, which is one of the premier mental health conferences in the country. We did a proposal based on our called More Than an Event, Funding a Crisis Response Ecosystem. Crisis response was one of their focus areas this year for their conference. And I think they had received, what was the number of proposals?
800.
800 proposals and
26.
selected 26.
26, I believe.
So it was like 3% is highly selective and we were selected. So we'll get to take some of our work to a national audience and showcase what we've been up to. I'm very excited about that.
When is that?
June.
Wow.
Yeah, and they will
It's a.
live stream the actual conference. Presenters do have to be in person, but they live stream to the broader audience. So board members will actually, you don't have to fly to Washington. You can watch online.
Very nice.
Terrific.
And that concludes my monthly activities report for this month.
Okay. All right, so then, what we want to do is move to our action items for today. And the first one being, we need approval for the minutes of our January 2023 meeting. So move. All right, so
Second.
Dr. Copeland, second. Okay, Dr. Gorski, second. So, all those in support of the monthly of the meeting minutes, say yes. Aye, okay. Those opposed? Okay, all right, so we have passed that. The next piece is our manual, or I'm sorry, schedule update. And so if you remember, we agreed to try to set up an opportunity to get together to spend more time talking about our strategies and our future. So this was in our packet. So I would like a motion to accept this revised schedule for our year.
So
Okay, first key.
Second.
Okay. Dr. Giardini seconds the motion.
I don't want to be.
So, all right. All in favor of the change of the adopted schedule? Aye. Anyone opposed? Okay, appreciate that. All right, next then, we have a manual that has been developed for future board members, or even if we would like to kind of review where we are with the total package. Now, who today, are you going to Chelsea present or Jason?
It's really, yeah, I can just speak to it briefly.
Okay.
This was something we learned about at one of the ACMI conferences that we went to. And it was Madison County had put together this type of manual for their board members as a reference guide, but also for helping to support the onboarding of new board members to understand just the different statutory requirements, the bylaws and all those things. And so we thought that was really a best practice and wanted to make that an easy reference for our board members and onboarding with new board members. So we put it together, reviewed it with legal counsel. They had some suggestions. We've got it to their kind of level of what they required of us, and now it's just ready to basically put forward. I mean, should have pretty much everything that any new board member would need to know to get them up to speed with how we got where we are.
I want to say I thought it was excellent, I thought it was well organized and very important. So you need a motion. I will so move.
Moved. For acceptance of the new one, all right, Dr. Giardini seconds it. Okay, so we have a motion to accept the board member manual that's being developed by staff and legal staff. All in favor?
Aye.
Anyone opposed? Okay, accepted. All right. Next, we have a series of resolutions that we are taking on today. And the first one is this resolution number 2023X, resolution authorizing the Winnebago County Mental Health Board for our program year for 2023-24. And whereas the Winnebago County Mental Health Board is a community mental health board operating pursuant to the Illinois Community Mental Health Act 405 of the code. And whereas the Winnebago County Mental Health Board published a 3-year strategic plan defining priorities, target populations for the program years 22 through 24, and released a notice of funding opportunity for the program year 2024, requesting abstract proposals for new services that fill a remaining service gap. This would be eating disorder treatment, harm reduction or low-income detox services, infant and early childhood, older adults, substance abuse, family and community support, supportive housing for youth, families, and adults, and youth crises services for those 5 through 17. And whereas up to $20 million is available for funding for the renewal and new proposals. And whereas the Winnebago County Mental Health Board received 26 abstracts for new services, and whereas the board members received, evaluated, and scored said abstracts according to an established rubric that was published alongside the notice of funding opportunity, and developed recommendations for either receive full new application, receive new applications with modifications, merge new application with continued funding request, or not recommended to receive application. Whereas the following determinations into the consideration of evaluations of each individual abstract, as well as a system level analysis, including duplication of services, fidelity to identify gaps, alternative funding sources, cost effectiveness, authority and capacity to implement, and equity of allocation to organizations. And I would like to add my comment about the fantastic job that our director and his staff have done in developing a process to address those goals. So with that, section 1 of this resolution would be that the Winnebago County Mental Health Board is willing to accept full application for services as proposed by the following abstracts: Brook Road United Methodist Church for a art therapy program, City of Rockford Health and Human Services Department, expanded comprehensive mental health services for young children and families in Head Start, NICNI, the Rockford Area Management Training and Community of Practice, Summit Academy for Summit Academy's transitions and curriculum, and the University of Illinois College of Medicine in Rockford for Addiction Medicine Fellowship. In section 2, the Winnebago County Mental Health Board is willing to accept full application for services proposed with modifications from the following abstracts. Alignment Rockford and how are our children. Systems change through community data. Boys and Girls Club of Rockford. Social, emotional, skill building and severely emotionally disturbed services. City of Rockford and Human Services Department. Impact Program. Integrated Mobile Partners Action Crisis Team. City of Rockford Family Peace Center. Inclusive Wellness Programming at the Family Peace Center. Prairie State Legal Services. Housing Stability Services. Rosecrans Health Network. Rosecrans Institute for Professional Advancement and Clinical Experience. Rosecrans Incorporated, the Winnebago System of Care. The Liam Foundation, LGBT plus peer support groups. The Tommy Coral Memorial Fund Foundation for family and community support and education. The University of Illinois College of Medicine for Merit, Medical Evaluation and Responsive Initiative Team. This is for enhanced services in community prevention education. Winnebago County Assistant State's Attorney for Mental Health. And finally, Youth Services Network, Mental Health for Homeless Youth. In section 3, this is the category where the Mental Health Board will merge the following abstracts with continued funding requests. The organizations are Stepping Stones of Rockford for construction of supported housing for adults with serious mental illness, and the Winnebago County Sheriff's Office, the Winnebago County Jail MAT program, meaning for calling for implementation. And finally, the section 4, and that is the Winnebago County Mental Health Board is not willing to receive full applications for services proposed from the following abstracts. Megan Alberto for Forest Therapy Certification Services. Rockford Park District Foundation, Hope and Healing with Horses through Lockwood Indoor Equine Center. Rosecrans Incorporated for Rosecrans Champions of Hope. Rosecrans Incorporated Dialectical Behavior Therapy, Psychologist Expert for Recruitment and Program Development. Rosecrans Incorporated Adult Trauma Program. Next, the Stepping Stones of Rockford, the Community Support Team, Removing Barriers and Building Support. And the University of Illinois College of Medicine, Rockford, Tailored Treatment, Utilization, and Substance Use Therapies program. From a legal point of view, section 5, if any section, paragraph, subdivision, clause, sentence, or provision of this resolution shall be adjudged by any court of competent jurisdiction to be invalid, such judgment shall not affect, impair, invalidate, or nullify the remainder thereof, which remainder shall remain and continue in full force and effect. Section 6, this resolution shall be in full force and effect upon its passage, approval, and publication in pamphlet form, which publication is hereby authorized. So I would need I would need a motion that we accept these proposal or this recommendation for our funding proposals for the coming year from the board. And because this is related to money, I'm going to ask for a roll call vote. Okay, so Mary Ann Abadi is not being present.
Motion.
Oh, I'm sorry.
We don't need,
I
we don't need to do
apologize.
roll call, that's fine.
I think we do. Yeah. Yeah, I would have liked to do that because of the matter that we're voting on. Dr. Copeland?
We get a motion.
You get a
I'll-
okay, sorry about that.
I'll second.
Thank you. All right, so moved by Wendy Bennett and seconded by Dr. Gorski. So Dr. Copeland? Aye. Dr. Giardini?
Yes.
Dr. Gorski?
Yes.
Richard Clinton? Yes. Wendy Larson Bennett?
Yes,
Okay. That's Tim Neighbors and Linda Strandquist are not here today. All right, so we have approval of these. Now we're going to get the.
Can we get a round of applause for Dick for reading that?
Yeah, nice job.
Okay, well, here we are again. The second resolution. Okay. This is, this resolution has to do with, a sort of last minute change with the Rockford Sexual Assault Counseling Center. And so, because of like where we are in our process, it was recommended that we do it as a resolution and to make this addendum to our process. So whereas the Winnebago County Mental Health Board is a community mental health board operating according to the Mental Health Act, and whereas the Community Mental Health Board published a 3-year strategic plan and released a notice of funding opportunity for the program for 23-24 new and renewal of applications. And whereas the submission for renewal applications ended January 18th. And whereas one of those applicants, Rockford Sexual Assault Counseling, submitted a letter which is attached to the Winnebago County Mental Health Board on February 3rd, 2023, requesting that it be included for review with their application. Whereas the letter received from RASAC details unique circumstances through which RASAC was notified on February 1st, 2023, of a potential significant reduction of funding from the Illinois Coalition Against Sexual Assault Counseling. And whereas Winnebago County board members begin the review of renewal applications on March 1st and intend to make renewal decisions on May 3rd, 2023, now therefore be it resolved by the Winnebago County Board as follows. Section 1, that the Winnebago County Board hereby accepts the addition of the letter submitted by RASAC to be considered along with their application for renewal funding, acknowledging that this does not amend their application or their request amount and in no way guarantees a favorable determination for their application for renewal. And then section 2, and again, any section, paragraph, subdivision, clause, sentence, or provision of this resolution shall be adjudged by any court, competent jurisdiction to be invalid. Such judgment shall not affect, or invalidate, or nullify the remainder thereof, which remainder shall remain and continue in full force and effect. This resolution shall be in full force and effect for the passage, removal, and publication pamphlet, which is hereby being authorized. So I need a motion.
I have a question.
Yes, sir.
Okay, maybe I missed this.
May we have the motion first and then we can.
Right.
Okay, second, okay, so Dr. Gorski moved and Dr. Copeland second. All right, Dr. Giardini has a question.
Okay, did I, unless I missed something in the wording here, nothing changes in what they're asking for? Is that what I understand? No funding changes or anything? So why is this letter necessary?
Could I clarify?
Sure.
Our current application process this year allows for board members to make recommendations of eliminate funding from a continuing program, maintain funding at the current amount, reduce funding, or to increase funding. So this is not to amend their application, but simply to allow for additional evidence to be considered with their application. So a board member could make the decision to recommend an increase in funding based on this
Okay.
additional evidence, or they could make a recommendation to any of those other categories.
Okay, so they're just informing us what's going on, so that we weren't aware of it, if an amendment needs to be made.
And we found out about, they found out
After the fact.
February 1st.
So it can inform your decision and recommendation, but it's not an amendment formally of your application, and that's the clarification.
Makes sense. Yeah, I mean, why write the letter? That is.
So while it's not directly, a direct money matter, it is in the process of us doing grants. So with your approval, I would like to do a roll call vote on this, okay? So Dr. Copeland? Aye. Okay, Dr. Giardini?
Yes.
Okay, Dr. Gorski?
Aye.
Okay, Wendy Bennett?
Aye.
Dick Leonard? Yes. Okay. All right, so the resolution, passes.
And at what point would we begin discussing the potential dollar changes?
If you recommend an increase for funding, we'll have those. I mean, that's where we have to look at the big picture of kind of what everything looks like together and what is able to go down, what needs to maintain, what goes up.
And are we premature in that at this point? Or
I think we're premature to get into specific dollar amounts on any particular proposal until we at least get the feedback from board members on the reviews, and then we've kind of put that together in one big picture scope, and then start to play funding scenarios in terms of how it all fits together within the package of money we have.
I just wanna say that this is devastating, not only for our staff, but for our community. They provide a incredibly important resource.
Absolutely. I was thinking the same thing.
And I hope we can consider meeting their funding needs depending on what happens with the state grant.
Will the letter from the executive director that's in the packet be included with their application?
Nicole can speak to that, but she will give the required attachments to all the reviewers.
Good.
Okay, so folks, the final resolution has to do with simply changing line items for money for ramp. So again, this is resolution for amending our funding program budget updates for the program for 22 to 23. And again, we have I'm going to skip down to whereas one of those funded programs requires a budgetary change to reallocate funds to better fulfill their approved scope of work. Therefore, be it resolved by the Winnebago County Mental Health Board as follows. One, the Winnebago County Mental Health Board hereby approves the following updates to the funded programs of fiscal year 23 budget set forth before. And essentially, they're changing money from supplies to personnel. So the budget is updated, is intended to personnel and training that was called for by our board. So they give the lines that are going to be changed. So I take it this is, we're talking about a change of about $10,000 within this agency.
Yeah, it's no change in scope of work. It's just a way of reallocating funds where one thing was overestimated in budget to an area where something can better utilize that amount to meet the objectives of the grant.
Okay. So again, the last section of this resolution represents our legal position. Any section, paragraph, subdivision, clause, sentence, or provision of this resolution shall be adjudged by any court of competent jurisdiction to be invalid. Such judgment shall not impair, affect, or invalidate or nullify the remainder thereof, which remainder shall remain and continue in full force and effect. So therefore, I would entertain a motion that would allow RAMP to make this budgetary change. Okay, all right, so moved by Ms. Bennett and seconded by Dr. Giardini. Okay, I'm gonna do the roll call again because we have money involved. Yes,
Good question.
Dr. Gorski.
Nicole or Jason, I'm assuming that you were in discussion with them about this and find the reallocation understandable and credible.
Yes, very much so.
Yes, and there's additional documentation in your packet that has more explanation in addition to their budget in its entirety, so
Yeah.
there's.
Great, thank you.
Okay, so Dr. Copeland? Aye. Okay, Dr. Giardini?
Aye.
Okay, Dr. Gorski?
Aye.
Dr. Wendy Bennett?
Yes,
Okay, Dick Hunter, yes. All right, so therefore, the request has been approved. All right, so we move to discussion of other items. Would you want to speak to?
Sure,
What
yeah,
you-
I will, and I'll just say, we were able to publish our updated annual report. And also we have our community impact report, for the first grant year, which had ended in May. As many of you know, we had hired journalists to go through and really do a qualitative analysis with each of the agencies that completed their first year of funding. And so you'll see in that some stories along with some infographics that highlight some of the data parts of it as well that we collected through our quarterly outcomes reports. So please take a look at it. The annual report, we're pretty confident with. The community impact report, if you want to be our proofreaders, we printed just 15 of them, and we're happy to, if you find an error in it, we're happy to update that before we publish a larger number of them. But we'd really like to get the word out to more people about all the great work that our programs are doing, about where we are in our kind of goals on spending and things like that in the annual report. And I'll just highlight, these were really team efforts across the board, but Chelsea really put together the annual report. And Kara, who many of you have met at some site visits, she was the main lead on the impact report, so I'll give her some credit on that as well for her great work on that. And then the last thing you'll see is Northwest Quarterly did a really, Chris Linden for Northwest Quarterly is a great local journalist and did a very deep dive into the intersection of criminal justice and mental health in Winnebago County. And I haven't read a kind of long form journalism article like that in a while that really went into that depth on a local level. It was really well done. 10 pages, I think, something like that. And so he interviewed so many agencies, so many programs, so many community leaders on this. And so I just set those out for you as well, if you'd like to take one home and take a look at that story.
we need to hang on to this for when we begin to ask the community to renew the mental health board funding process. Because it really captures the incredible work that's being done.
And these are protected.
Yeah, congratulations. That Gordon's work.
Just
Yeah. Yeah.
so well done. I'm after perusing it
And
now.
all the graphic design was done in-house. We have a graphic designer here, Miranda, and she graphic designed both of those reports. And she's a real talent out there.
And the idea is eventually we will print more and get those out.
We have 50 annual reports already because we were pretty confident that those were ready to go. So you're welcome to take an extra copy if you have, we have the handouts. We have hundreds of the handouts. So hand those out in mass. You can take with the annual reports, you might want to be a little more strategic with who you want. And those we can kind of gauge what our distribution is after maybe you've read it and see what's the number we want to order. They're obviously a little bit pricier than the printouts, but we're able to get a pretty decent price on the print on those. So I think we could do a larger number of one within our current year budget.
Really well done.
Okay.
So please take a review, and then if you have ideas when we come back together in our next meeting about what our distribution for that should be.
Every number. Yes. In hard copy, and then relying on the website.
Right.
We'll have a tendency to look at it.
Yeah. I think we could easily print 20 of those.
Yeah. Okay.
Agree completely.
So, do any of you folks, staff, I'm talking about, want to bring up any issues or share with the board, what Nicole, you've been doing in terms of agency visits that you might want to highlight?
Sure, I can give just like an overall, and then, I'd actually appreciate if anybody that's attended a site visit, if they have anything they'd like to share. So like we mentioned earlier, so different, we've gone on lots of tours so far, so being able to visit programs, so to see the space, see staff that are funded by the mental health board, hear about different individuals that they're working with, kind of talk about successes of their programs or agency, in addition to any barriers that they're experiencing. As well as we've really been asking about kind of systems level concerns, so not just what one individual is experiencing, but what might be systems concerns that the mental health board could potentially assist with. So, so far, I think they're going amazing. We've been so well received, I feel, when we go places, and people are really excited to have us. So I think that's very exciting. But yeah, anybody that has attended, if people want to share their experience or thoughts about them so far.
I think, Nicole, you've done a great job with this.
Thank you.
I know some of you have been on these site visits, and I mean, it really is pretty amazing, because for me, I mean, we give out a lot of money. I want to see it's being well spent. You know, I know it's not our money, but nonetheless, it's still money we're giving out. And other than just giving out willy-nilly, I want to see it being well spent. And these people that we've been at so far, and I hope I can attend more of them.
Yeah.
Is because they are very appreciative, and they will tell you in detail what's going on with that stuff. Because all too often, you know, government funded things can get so diluted, you know, and but it's been well done. So thank you. Appreciate you
Thank
doing
you.
that, because I want to see more of these places. I want to go back to some of them. I want to see how it's going. I mean, the one on Monday, where did we go Monday? That church that's in the Y.
Why?
The Y, if you were in that church,
Yeah.
no church. Yeah. 51, I want to see this place when it's done.
Yes, for sure.
So, but anyway, they're doing a good job.
I think the other thing that my sense is that we get an opportunity to talk about systems, as Nicole mentioned, so that we're trying to break down silos
Yeah.
and get people to talk with one another, you know, and become familiar with the array of services that we're now putting into place. So it's, you know, I think it's a huge opportunity for us to promote.
Mentally fit,
promote
equal
what we're
time.
doing.
And I just also appreciate, I have worked at lots of different places and worked with lots of boards, but the level of engagement and investment you guys have is amazing. So I appreciate you coming and asking really good questions and participating, because it's not often that boards are able to be as engaged. So I just appreciate that very much.
I think it sends a message to the folks that we visit too, that we are concerned, we're interested, we want to make sure the funds are being helpful, and also at the same time ask the questions about exactly how are they being used, and I think your idea of revisiting maybe in a year is interesting. Places we've been to, you know, we were here a year ago and did wonderful work. What has happened in this past year? So I think it's a wonderful, it's been really good for me, you know, to meet some folks. So I've enjoyed it.
I was very impressed by Jubilee Center of Daisha Disney, because I think they're day-to-day supervisor. The stuff that's going on there is just phenomenal. You know, she has pulled in medical services and psychiatric services, so that while you're getting lunch on a Wednesday, you can have your psych eval. Downtown, they can prescribe medication where necessary, and downtown district, just whatever it's called, downtown drug store, discount drug, will deliver it while you're there. And that gets to, I think, one of the issues around homelessness and people who are experiencing mental health problems, who are also homeless. And the case managers are doing more of the, what I would call like the mom work, going, you know, okay, so Joe needs to get here tomorrow. And I mean, it made it clearer to me what they're doing, and then how our resources are helping them advance their mission. And we talked about, you know, they're talking about trying to have more places for homeless, mentally ill people to live, and Stepping Stones is working on that. And I'm like, you guys need to talk more, you know, so that we're collaborating. Anyway, but I was very impressed with her and the program, and the atmosphere there was lovely. So
Yeah, and to Wendy's point, we're trying, we as staff are trying to figure out a better way that we can contextualize outcomes, because we know all of these programs are doing great work. And so we want to make sure that the mechanisms we have for the reporting is easier for them, one, to make sure that, you know, less time is spent on providing information to us and letting them do the good work that they do, but also making sure that we can tell the story to the community, because there are so many amazing things that are happening, and we want to be able to be advocates for the people that are being funded, and be able to let people know the amazing things like Jubilee and all the other funded programs. Just the good work that they're doing, and people might not know, because if it doesn't directly, you know, apply to you, you might not be aware.
and also having a graph that says we serve 75 people, and 25 people, you know, were, you know, moved on to other services, doesn't really capture what's going on over there. It's just a number, you know, so we talked with Kara about that when we were there, and that's why it's been helpful to have her.
Yeah.
Because she's like thinking creatively about how can we better make this into a report that means something beyond just data points, so.
Okay. Any other items? Any other pieces for the discussion?
Oh, when do we begin our next reviews? I noticed it said on our March 1st, which is today, but when do we start
This
getting
afternoon,
our assignments?
Yeah,
Oh, you're
in
good.
10 minutes.
this afternoon, you need to go home and get things here.
So, Monday morning at 10 a.m., I am scheduled to send all of you your evaluations, so they've all been determined in a random process as the abstracts were as well. It's a very official process that I go through. So Monday morning, your evaluations will be assigned. They are due April 12th. This will be all in my email, so please don't think you have to memorize all of this. So you'll have 6 weeks to complete them. And then there's also some holds that have been placed for 2x2 discussion. So different evaluators to be able to meet should that be necessary. So you will receive an email with all of the instructions, and also if anybody needs technical assistance, I'm here. to be able to provide that. And then any documentation that's been provided with the continued funding applications, you will be provided if that's an application you are to evaluate. So all the modifications that have been proposed, for these that pertain to the continued funding, which are only two, you'll also have access to those abstracts as well. So, stepping stones, for example, should you not have already reviewed that abstract, you will have that abstract and board comments, so you are well informed of what decisions were made, so.
Okay,
Makes good sense.
so I'm open to entertain a motion for adjournment.
You normally do that, how we.
Who would like to step up?
Let's ask some people.
So moved.
Pretty good.
I'll second that.
Okay, all right, all in favor?
Aye.
Yeah.